कहिए कि सोसाइटी ही ऐसी है कि हम इन्वेस्टिगेशन शुरू ही फीमेल से करते हैं, तो मेल पैरामीटर्स कुड आल्सो बी द रीजन फॉर दिस रिकरेंट लॉसेस। सो डॉक्टर इशिता, जैसे हमने देखा कि अब ये मल्टीपल मिसकैरेजेस हैं और हमें इन्वेस्टिगेट करना है ऐसा क्यों हुआ और किस टाइम पीरियड पे मिसकैरेज है, कितने वीक से इट रियली हेल्प्स। सो अगर हमें मेल पैरामीटर्स को चेक करना हो, तो अदर देन नॉर्मल सीमन एनालिसिस, डू वी हैव एनी अदर टेस्ट दैट कैन जस्ट टेल अस?
Usually any type of parents कराते हैं हम लोग, but that does not do very good flow. A semen analysis report, not from some center somewhere, from a standard lab, that gives lot of clues. You have to look at the abdominal forms, you have to look at the pus cells, you have to give lot of thought not only on the counts, but you have to give thought on motility, you have to give thought on all these things. It has to be, you don't have to, you just look in between the lines when you're reading the semen report of these kind of patients. Smoking history, I'll tell you a story. A patient had come to me with 3 recurrent abortions. Every time she would come with the in-law, with the mother-in-law or sister-in-law or some female companion. So I told her, you get your husband, where is he? I want to see the report. Oh, he's very busy, he cannot come. वो वहाँ का report भेज देंगे, वहाँ का भेज देंगे. I said, nothing doing. I want to see him in person and I want to talk to him. So I will not write to you. I was very strict that I'll not write any medicine till I see him. So you will not believe, when he came, he was 100 kgs weight. 100 kg, HbA1c 11 when I investigated him. 11.
And we are just focusing on female.
She had big mota file of investigations. Everything under the sun was done. And second thing is that there are a lot of factors in the female that are responsible equally for a bad oocyte quality. Like the semen parameters, the lot of things, they hamper the sperm quality. Similarly, PCO and endometriosis and adenomyosis. These 3 things actually जो है वो egg quality बहुत खराब करती है. She is ovulating, she is doing everything is fine, but the fluid in the pelvis which is there, or the small little fluid that is there in pelvis, that is embryo toxic. For that matter, in hydrosalpinx, do an HSG, see there is an hydrosalpinx. Hydrosalpinx may abortion is very, very common because the fluid in the hydrosalpinx is embryo toxic or fetotoxic. So that is another cause of abortion. Even if you give a full course of HET, but till you don't tackle that hydrosalpinx, you will not have an outcome, because it is very difficult to convince these patients to undergo a salpingectomy or just clipping of hydrosalpinx, because question ये कि अगर हम hydrosalpinx एक ट्यूब मैडम बंद कर देंगे तो बच्चा कहाँ से आएगा? Because if there is bilateral hydrosalpinx, then best is clip in hydrosalpinx and go in for IVF, because without that you will not have a successful pregnancy, even if you have given a full course of HET.
Right. And I believe that time plays very important factor in during this whole procedure, because हम हर महीने किसी न किसी वजह से चीजें डिले करते जाते हैं. And I have seen. हाँ जी, please.
Yeah, no, I'm just agreeing with you. The time plays a very, very important role, because these days everyone is marrying late. जो लोग सेटल्ड है वो शादी नहीं करना चाहते, जो अनसेटल्ड है वो भी शादी नहीं करना चाहते for some reason. And you know, lot of things, हम लोग जो पुराना प्रोसेस होता था कि गर्ल्स मैरी यंग एट द राइट एज, वो कॉन्सेप्ट आई थिंक कुछ हद तक, आई डोंट अग्री विद मैरिंग एट 20 years or 18 years, not that, but at least 25, 26 is quite a good age to get married. You're almost on the path of your career, and because lot of things are covered up by a young age patient. Same problems when you're tackling at the age of 35 take a whole new dimension and whole new meaning.
Right.
I had a friend's wife, and दोनों में age gap was around 10 years of marriage. One of the husband was 10 years elder to the wife, and she used to have severe dysmenorrhea. She used to be like a fish in the water when she would have her periods. So when we came, And she was, by the time when she got married and she came to us, she was only 20 years of age, just finished her BA college and came to us, not conceiving. So when we saw she was almost 8 week size uterus, and we told her, since the so less time has passed, you plan a pregnancy first. So with progesterone support, we made her plan a first baby. She had a vaginal delivery, breastfed for 1 year. As soon as she was about to wean off the baby totally, I told her that you should plan your second child quickly, as
Hmm.
quickly as possible. Don't delay this. So she was, the husband was very skeptical, she was also very skeptical. इतनी जल्दी एक बच्चा हो गया मैडम, अब इतनी जल्दी आप मत करिए please, don't do this. So I told her, no, you will thank me one day. So that was after their life. And then she luckily conceived a second child very quickly, because this endometriosis and adenomyosis, they are suppressed by the pregnancy and the breastfeeding. Huh. So she conceived again. She had both the babies, and by the time that time, that was the days when LNG IOD was not freely available, and it was costing close to 10,000 rupees. And it was not even available in tier two cities. You have to get them from Bombay. Request that MR to give it to you. So by the time that had come, and as soon as she delivered, I told her, when your symptoms return, just come back to me. Now she is on fourth Mirana in her life.
Okay. Okay.
Fourth mirror. And I have not removed her uterus. She is 42 years old now. And she is absolutely doing fine. Regarding the uterus part, she has other problems. That's a different story. And now with both the children is, now the son has come back and is taking care of the business. So that
Right.
is, that's the age factor. Because
Right.
यही 32 years में तो she would have gone in for IVF. Because
Right.
things would have gone bad to her. Hmm.
एंड इवन अगर आप आईवीएफ भी प्लान कर रहे हैं देन आल्सो डोंट डिले थिंग्स इट्स लाइक कि आईवीएफ ही करवाना है हो जाएगा क्यों इतना जल्दी करना
Yeah,
बट
that's the biggest myth, you know. That's the biggest myth. If to just put in their head, बोले वो तो कभी भी हो जाएगा, ऐसे कभी भी कुछ नहीं बचेगा करने के लिए. That is the biggest. Last resort तो वो है, हमने कहा ये last कई cases में वो last resort नहीं होता. It is the first resort. So because most of the time your eggs are your late age, and it's bad. Abhi, we stimulated patients twice. There was no oocyte was formed. And it is such a sorry state of affairs, because 42 years age, what do you do? Because the oocyte quality is bad. There is adenomyosis, there's everything has come into play. So, and insistence ki I want my own egg. So that happens.
right so Dr. Ishita, here we'll take one query. The lady